Welcome to You're in Good Hands, the podcast where we dive into everything urology, leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. Okay, so, we always like to dig into some really interesting stuff here, and today is no exception. We've got some fascinating material all about Peyronie's disease. And this was put together by Advanced Urology of Georgia. We're going to really take a deep dive into this and try to answer some questions for you. What is it? How common is it? What are some of the causes? What are the signs? What are we looking for? How's it diagnosed? And then, importantly, what are some of the treatment options? Both, non-surgical and surgical. And of course, we'll touch on monitoring the condition as well.
Sounds like a plan.
So a really good overview, I think, of Peyronie's disease based on all this great information from Advanced Urology of Georgia.
Yeah, and I think to kick things off, it's really important to understand what exactly we're talking about here, right? The nuts and bolts of Peyronie's disease. So basically, it involves the development of this, fibrous scar tissue, sometimes called plaque, and this develops inside the penis. Right. And that's really the root of the problem here, because this plaque is what causes the penis to have an abnormal curvature. And this becomes, especially noticeable during an erection. Now, it's not just a bend, though. This plaque can also be painful, especially in the early stages. And it can make it really difficult for a man to, achieve and maintain an erection.
Right. Makes sense. So it's almost like a thickening or a hardening of the tissue that's pulling things out of shape.
Exactly.
So when it comes to how often this happens, is this something that's relatively uncommon, or are we looking at something more widespread?
Well, that's what I found really interesting, digging into this material from Advanced Urology of Georgia. It turns out that this condition affects a surprising number of men, something like 10%.
Wow.
And it's, most commonly seen in men over 40. But here's the thing. That 10% figure?
Yeah.
That might actually be a low estimate.
Really?
Yeah, because it's a sensitive topic. It can be embarrassing. You can understand why some men might be hesitant to, bring it up with their doctor.
Oh, yeah, absolutely.
So the actual numbers could be even higher.
So underreporting. Yeah, that makes sense. So, one of the things that Advanced Urology of Georgia mentions is that a common cause is trauma or injury to the penis. So when we talk about trauma, are we talking about, like a one-time major event, or can this be something more subtle?
Yeah, it's not always a single event. I mean, certainly a significant penile injury can trigger it. But Advanced Urology of Georgia, they really highlight the role of, repeated minor injuries.
Okay, interesting.
And these can happen during sex even, just from the natural, forces and pressures.
Right.
Now, normally the body repairs itself right. But with Peyronie means this healing process kind of goes off the rails. Instead of, healthy tissue, you get this buildup of scar tissue.
Like an overreaction almost.
Exactly. It's like an overreaction. Now, why some men develop this scarring while others don't? Well, that's not fully understood. And that's where, genetics might come into play, or maybe some autoimmune factors.
So it could be a combination of things, not just a single incident.
Right.
That's helpful. So let's say someone's listening and they're thinking, maybe this is something I need to look into. What are some of the signs or symptoms they should be aware of?
Well, I mean, the most obvious one, and it's the one that most men notice first, is a bend or a curve in the penis. And this is when it's erect, of course.
Okay.
But it's not just the shape. Some men also experience pain in the penis.
Oh, wow.
And this can happen even when it's not erect.
Yeah.
But it's often worse during an erection, especially early on.
Right.
Another thing that can happen is the penis might actually become shorter or narrower.
Really?
And then, of course, because of the curvature, some men find it really difficult or even impossible to have sex. So it's really, a combination of things.
Yeah, so a lot of potential things to be on the lookout for. So someone's noticing these changes. What's next? How is Peyronie's disease diagnosed?
So the process usually starts with a good old-fashioned physical exam and a review of the patient's medical history, of course. The urologist will actually examine the penis feeling for any hardened areas of tissue, the plaque that we talked about, and they'll also assess the degree of curvature. And then to get a really detailed picture, they might do a penile ultrasound.
An ultrasound?
Yeah, and this allows them to actually visualize and measure the plaque.
Okay.
And also look at blood flow in the penis.
Right.
So that helps them understand the extent of the condition.
Got it. So hands-on exam and then imaging if needed.
Exactly.
Now let's talk about treatment. What are some of the non-surgical options that Advanced Urology of Georgia might consider?
Yeah, so non-surgical treatments are often the first line of defense, especially if the condition is caught early or if the symptoms aren't too severe.
Okay.
So one option is oral medication. Pentoxify is one that's often used. And this medication can help improve blood flow and potentially slow down the formation of scar tissue.
Okay, so kind of attacking it from the inside.
Exactly. Another non-surgical option is penile traction therapy. And this involves using a device to gently stretch the penis over time. And the idea is that this stretching can help to gradually reduce the curvature.
Okay, so a more physical approach.
Right. And then there are injectable medications. Collagenase is one that Advanced Urology of Georgia mentions, and this is an enzyme that's injected directly into the plaque to help break down the scar tissue.
Interesting. So a few different ways to potentially address it without surgery.
Yeah.
But at what point does surgery become a more likely option?
Yeah, so surgery is usually considered when the curvature is so severe that it makes sex impossible, or if there's also erectile dysfunction that hasn't responded to other treatments. And there are a few different surgical procedures. One is called popliteation surgery, and that basically involves shortening the longer side of the penis to straighten it out. Another option is plaque incision with grafting. So the surgeon makes an incision in the plaque and then uses a graft to lengthen the shorter side of the penis. And then for men with severe Peyronie's and erectile dysfunction, a penile implant might be the best solution.
Oh, wow. So the implant would address both issues.
Exactly.
So, with any surgery, there are potential benefits and risks. What are some of the things that Advanced Urology of Georgia would discuss with a patient who's considering surgery?
Well, the benefits are, pretty clear. Improved function, a better quality of life. But it's also important to understand the risks. There's a chance of temporary numbness, some shortening of the penis might occur, and in some cases, the curvature can even come back. And of course, recovery time varies depending on the procedure. So having a thorough discussion with the surgeon is really key.
Absolutely. Informed consent is so important. Now let's talk about long-term management. What about monitoring and follow-up care?
Yeah, this is something Advanced Urology of Georgia really emphasizes. Regular follow-up appointments are key. These allow the doctor to monitor any changes in the curvature or pain levels. And that helps them to adjust the treatment plan if needed.
So it's not just a one-and-done kind of thing.
Right. Ongoing monitoring is essential.
So to wrap things up, what are some of the most important takeaways for our listeners who might be concerned about Peyronie's disease?
Well, I think the key takeaway from all of this is that Peyronie's disease is treatable. If you're noticing changes, don't wait to seek help. Early diagnosis is so important. It really can make a big difference.
Absolutely.
And, Advanced Urology of Georgia, they're a great resource. You can reach them at 678-344-8900 or visit their website at www.advancedurology.com, and they have locations all over Georgia.
So easy to get in touch with them. All right, so just to summarize, this deep dive into Peyronie's disease, we've learned that it involves scar tissue in the penis, which can cause curvature pain and impact sexual function. But it's more common than you might think, and there are treatment options out there. And early detection and talking to your doctor are really important.
Yeah, and I think, it's worth remembering that it's okay to talk about these things. Sometimes we avoid discussing these sensitive health issues. But understanding conditions like this and knowing that there's help available can really empower people to take control of their health.
That's such a good point. Well,
Yeah.
Thank you for walking us through all of this. Until next time.
My pleasure.
If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.